Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast. I'm your host, Chet Speed, and I am with the outstanding AMGA public policy team, and we will go to our left today.
Alicia Sawyer, Government Relations Assistant. Happy to be here.
Lauren Latney, Director of Government Relations. Can't talk for a second,
Yeah.
so
Good, it's a podcast.
My tongue got twisted too.
Yeah.
Let's see how Daryl
Watch me nail this one. Hi, I'm Daryl Drevna, Senior Director of Regulatory Affairs.
You paused.
I did.
Yeah.
I almost forgot what my title was.
Outstanding.
Okay. So,
End of your emails.
Yeah.
You never know. All right, question of the
say
day.
I'm getting a new title? Or
Oh, good God. You can go up or
Yeah.
down. It
Oh.
all depends. So the question of the day, what is your favorite fall activity?
I like to have picnics outside in the fall. I like the breeze. I like hearing the trees and the leaves fall.
I love apple picking. I still
Oh,
have
do you
my Butler's Richard
You may want to get rid of that.
I don't want to get rid of it.
Okay.
I'm 5 years old now. But I went apple picking last weekend. It's so therapeutic and you're on the land and you're harvesting stuff. It's
The good old days.
good old days.
Yeah.
Yeah. So it was a lot of fun.
Did you go to Poolsville or Maryland?
Went to Germantown.
Okay.
And it was a fall festival, a pumpkin festival. So kids were running around, screaming. There was a corn pool of corn kernels. There was a pumpkin chute. And then you had the apple orchard and then pumpkin patch. It was a lot.
Awesome.
It was well worth the money, I think.
Okay, good.
Yeah.
Yeah. Those are a lot of fun.
Yeah.
We did that also last week.
Oh, fun.
Yeah, it's great.
Yeah. Good cheap, fair food.
Mm.
You didn't agree
No.
on the cheapness.
we there was no food there, just pumpkins for us.
Oh, okay.
But yeah, it's great.
Nice.
Yeah. Daryl?
it's I'm a big sports fan and it's football season, so going to a game in the fall is the best where it's a little bit of crisp, you're not baking in those early September games and you're not freezing yet in January, so this is ideal football weather.
Yeah. And you saw the Steelers on Sunday.
I did. Big
Did
win.
they win?
They did.
Oh, yeah?
They
Who
did.
did they
Well,
beat?
they beat the Browns, which is
Oh, come on,
Okay.
please.
I can beat the Browns.
They've been bad for so long. Bring back. Well, all right, I'm having troubles too. Bring back Brian Sight,
wow.
number 17. There we go.
Yeah.
Cardiac cards. All right. Well, I'm glad you all are here. And Jamie Miller, our other outstanding teammate, is in Seattle, I believe, talking to AMJ members out there. So, Jamie, good luck and do well. All right. So, and Daryl is now pointing his finger at the outline he gives to all of us.
He does stare very pointedly at
Oh.
me right now.
It is a little,
Yeah.
it's a little intimidating. So I will get to it right now. The name of our podcast today is Shutdown, Shockwaves, How the Stalemate is Hitting Healthcare. That's we're going to talk about the shutdown, what is impact on AMGA members, some of the politics around the shutdown and why it is happening and when it may end. And there we go. It is the big discussion point in DC right now. So let's go. So Lauren, what's behind the stalemate? Why did this happen? It's healthcare?
It's healthcare.
Okay.
It's something that we work on every day. And so that's why we're having this conversation. But I think if you ask Democrats straight out, Democrats are demonstrating that they would like to show more aggression in terms of their response to the Trump administration and to the Republicans in Congress, particularly around the healthcare cuts that were done under the One Big Beautiful Bill Act, OB3. But I think it also is a larger conversation, too, because it includes the expiring healthcare provisions, including the enhanced ACA premium tax credit, So it looks like to me, if you're like pulling it out further, what does a baseline of care look like in the United States is what the real conversation is around. If you're taking away Medicaid funding, which is a baseline for people who are of low income, disabled, plus you're reducing the amount of tax credits, not completely getting away, but like reducing the expansion of ACA tax credits, which allowed people to purchase plans at the ACA market at a much, much lower rate than they would pay normally. And also, what are you looking at in terms of provider cuts and all of these other things? What does a baseline of care look like in the United States? And so that is largely what this conversation truly is about. Republicans have made their statement of saying that there needs to be more market-based care and that it should be less subsidized. Democrats are arguing that having care, even at a minimum, helps reduce the cost of care in this country. And so they're going back and forth on what that looks like. And it might be us having this conversation a month from now.
Okay. So so where are they right now? Who's talking to whom? What are we hearing on the ground, on the Hill? Do you see an outcome in the next few weeks?
I think Jefferson Johnson are talking on CNN. They're going to do a debate.
Jefferson Johnson?
Yeah.
Are they really?
Yeah.
When is that?
Yeah. They are the majority and minority leaders on the House side, or Speaker of the House and minority leader on the House side. They could have this debate on the House floor if they wanted to, but because the government is shut down, they have decided to go on CNN where they have a wider audience instead. But mainly, it's a strange vibe in the city. Senate is in session. They're passing appropriations bills with the assumption that maybe Democrats will break this stalemate and vote in terms of this. But you also have like not real conversations because unless President Trump is involved, then all this is for naught. You know, he is the lead negotiator when it comes to Republicans. He is the lead appropriator, it seems now, when it comes to how finances are done and appropriations are dispersed throughout the country. And so until he gets back involved, we're going to continue to be in this stalemate.
Interesting. So 6 years ago, it was the air traffic controllers that basically called in sick a few days and stalemated air traffic on the East Coast. That did it. Could that happen again, do you think? Because they lost their first paycheck, I believe, today.
Yeah, today or tomorrow. Today or tomorrow. And it might be, but I don't know. You're seeing a lot more legal fights as well of who gets to be fired during the shutdown and who does not. And it might go longer. I think people are really doubling down on their positions. And maybe it ends because of those things, but it might be end because like maybe they're tired of just twiddling their thumbs, which is kind of what it feels like a little bit.
Yeah, I guess so. And interestingly enough, actually my wife asked me this, does Congress get paid during all this? The feds are not getting paid, including my sister and brother-in-law, but Congress gets paid, do they not?
They don't get paid.
They don't?
They will get paid like
retroactively?
Yeah, but like their last paycheck was also today.
Oh, interesting. And I know a key constituency up on the Hill, the Capitol Hill Police, also, paid. Yeah, they're not paid now either.
Yeah.
And their union is getting a little upset.
A little agitated. The only place that's really open on the Hill that is functioning is the Congressional Federal Credit Union. Shout out being a member.
Me too.
Yeah. And what's happening is they're offering interest-free loans, advanced loans for people because, you know, you don't get paid at the end of the month. That doesn't stop your bills from coming in.
No, it sure doesn't.
And so offering potential financial models for like payment models might be there until like Congress is back in session.
All right. And I guess another key date is November 1st. That's when the ACA premiums go out.
Yeah.
And
they're going to be high.
Very high.
Yeah.
And that may cause a constituency response.
Yes, we're already seeing it. And it's going to cause constituency responses with Republican districts.
Exactly.
Which is what Representative Marjorie Taylor Greene has been sort of ringing the alarm on of saying like, oh, when you get rid of the enhanced ACA premium tax credits, some of these premiums are going to double, some might triple. And so she's ringing the alarm to Republicans of like, this is not just going to help affect Democrats. This is affecting you as well. If you're you're a Republican in a D plus 3 or 5 district, that is really hanging the balance whether you get reelected again.
That's a big, big deal. Well, I'm traveling to Palm Springs for an AMJ meeting on November 5th. I really hope that it's done by then.
We'll see.
We'll see. And we're leaving for Iceland and Thanksgiving. So we need to get this thing done. importantly.
For,
Okay.
for travel plans,
Absolutely.
especially.
Yep. It's all about, to quote Daryl, me.
Main character energy right here.
Yeah. Okay, so we talked a little bit about the politics and where this is going, where it might end. So immediate impacts on health programs. Alicia, can you tell me what's going on with Hospital at Home? What is it and why is it so popular?
Hospital Home is expired. It expired on the 30th, along with several other key programs and waivers that we'll get to later in the podcast. A little teaser there. But Hospital at Home was a program launched during the COVID pandemic. It allowed hospitals to lower capacity and free up beds for sicker patients by allowing some patients to be treated in their home, where they would have 2 daily in-person visits, immediate remote audio access to a provider, and the program has really grown and flourished. It has saved Medicare money. It has reduced the cost of care for patients and for providers. And as of July 2025, 400 hospitals across 142 systems and in 39 states participate in this program now. And during the 2-3 years of the pandemic, from November 2021 to March 2023, the patient served over 11,000 patients.
Wow, did not know that.
Yeah. And so it has become a vital program. A lot of our members, AMGA members, have invested in it. And without it, I think we're all kind of scrambling.
Yeah, and when the program expired, as you said, on September 30th, patients either had to be discharged or they had to go back to bricks and mortar hospitals. And the optics is just so bad on that. And someone who has elderly parents, you don't want them in the hospital. Daryl, so what type of conditions are being treated?
Yeah, I think
program?
the point you just made is really appropriate, because these aren't patients that you necessarily want to have back in the hospital. Under Hospital Home, almost 40% of patients had some sort of respiratory condition, whether it's, COPD or respiratory infection. About 16% had some sort of cardiac or circulatory problems, heart failure patients. About 16% of patients on this program had some sort of urinary condition. And about 12% or so had some sort of infectious disease, whether it's sepsis or cellulitis. I talked to a member the other day. He's like, we've got a bunch of patients in Hospital Home that either have cellulitis or they have pneumonia. And these aren't patients, they're doing well being treated at home, and now they're going to have to go back to the hospital where, the quality is very high, of course, but you don't want these patients around other patients necessarily.
Nope. And the transport's traumatic also.
Right.
Let's face it.
Yeah.
That is, you're an EMT, so was I.
Yeah,
that's not
carting
good.
those folks around is just a strain on them more than anything else.
Yeah, indeed. Alicia, any investment concerns from the members around the expiration of this program?
Yeah, systems have invested millions of dollars in this program because what you need are mobile devices, medical equipment, and vehicles for providers who go in and see those patients twice daily. And so they've put all of this money into a program that has been hugely beneficial, and it's being taken away in a sense.
Okay, indeed. So, Lauren, I know the Hill likes this program too. So what's their reaction to all this?
The Hill likes the program. Committee staffers like the program. I think one of the things that differentiates Hospital at Home from something like telehealth, which staffers have a lot of education on, is that staffers have experienced telehealth. They've done appointments. They've done mental health appointments. Whereas Hospital at Home is still, I think, an interesting concept for people's, particularly staffers who are off committee, where there's a lack of understanding of the program, because that's typically not, if you're a hospital having a visit, something you talk about. And so I've run into a lot of staffers not understanding the origin of the program or that the program exists. So there's a lot of education that needs to be done under Hospital at Home, just because it's just one of those programs that seems like it's very effective, has just been relatively under the radar. And I think also there's not a ton of controversy around it and waste fraud abuse conversations around it as well, which is probably another reason why it doesn't get brought up as much.
Okay. Yeah, well, maybe some of these Hill staffers, their grandparents go in, that would give them the experience.
Give them the experience, yeah.
Because you need to live things to really understand those things. Great. All right. A great program. We want it back in place as soon as possible. So let's shift to telehealth. Alicia, so what has changed about telehealth in the past few years?
Telehealth originally was only allowed when Medicare only covered telehealth services when a patient was in a designated rural area and when they left their home and went to a clinic, hospital, or other designated medical facility. And so during the COVID pandemic, another flexibility like hospital at home that was put in place were geographic waivers. So patients were allowed to receive telehealth services from in their homes. Providers were no longer restricted as to where they could administer telehealth services as well. And telehealth was expanded from just being for behavioral health services and mental health services, and was expanded to all areas of practice.
And those flexibilities expired.
They expired on September
30th,
30th as well, yeah.
All right. So, Daryl, what's been the reaction from our providers, our members, about the expiration of these waivers?
It's really a huge problem. To build on what Alicia was saying, you had about, more than 6 million telehealth visits in the past year, and all of a sudden those are no longer authorized. So if you're a health system or provider, what do you do with those visits? And option one is you just cancel them. Right, we just can't. These are no longer authorized. We need to get you in the office, so we're no longer going to schedule telehealth visits, or we're going to cancel the ones that are already scheduled and try to rebook you in our bricks and mortar. Which you imagine that's going to cause access problems. Option two, we're going to keep going with telehealth in the hopes that maybe we get reimbursed, and that creates a whole lot of problems because you're sort of gambling that you're going to get paid or reimbursed for the care you're delivering through telehealth, and Congress would have to step in, and then it creates all sorts of things because it's a not covered service right now. So you need to inform the beneficiary this is no longer covered under Medicare. That's going to create a whole lot of confusion. So it's really putting our AMG members in a tough position. And in talking to members, some of them are going option one, the rescheduling route. Some of them are plowing ahead and trying to keep these on the books and keep their telehealth visits to try to be as less disruptive to their patients as they possibly can.
Yes, that's rough. Lauren, you talked about the Hill views on hospital and home. Where are they on telehealth? You mentioned they're a little more obviously aware of telehealth because they actually do it.
They actually do it. And also some have come into on the Hill after all these waivers came into place, and so this is the norm for them. Like not understanding that it was very difficult to do telehealth just 6 years ago. Like,
it was, yeah.
It's the rapid transformation of telehealth is something that still gives me puts me in awe just how quickly the technology changed because policy makes these changes. And so the Hill response is this is very active bipartisan issue. We've been doing a lot of work on the Hill, encouraging members to endorse the Telehealth Modernization Act and also the Connect Act. And so you're seeing a lot of Hill response of people saying that they want to endorse these bills. We are hoping, we would love a permanent fix, but we also understand that billions of dollars right now is not necessarily where Congress wants to go in terms of spending. So we believe it will probably be fixed retroactively, but the extension might be 2 years, right? And so we're going to continue to have lobbying this over and over again, even with the understanding by people on the Hill that this is a important program that people use. But until the money looks right, we're still going to be having these conversations over and over again.
And good to know. It's funny, I was talking to Sharon, our communications head, and she said, well, with the government shutdown, what are the lobbyists doing for AMJ? I said, they're on the Hill all the time, actually. So
people are still, the offices are still open.
Yeah.
Parking is great. So if you want to go try to park there and talk to people, this is the opportunity. People are bored.
Yeah, no, I know Jamie, you, and Lisa have all been up there, talking about the need to get these things, to open the government and get these things passed again. Okay, a major issue, Daryl, Medicare fee-for-service claims. What's the deal with the government shutdown?
Right. So I think top of line Medicare claims are going to get paid, right? CMS put out some guidance on that actually this morning. It's really confusing, and what they're doing is they're holding claims to try to prevent them from having to reprocess them, largely because of the telehealth issue. They understand that some providers are going to move forward with and provide those telehealth claims, and they're sort of encouraging them to, maybe you don't want to submit those claims right now. Hold on to them. You've got a year to submit a claim under Medicare statute and regulation. But so if you do submit a claim, CMS has instructed the contractors that process these things not to do so. Originally, it was a 10-day hold. They've extended that. They've said indefinitely. But what that really means is they're going to adhere to the letter of the law when it comes to timely payment. And that's when they have 30 days to make a payment on a claim that comes in. So that is, as of this morning, that's what the guidance is from CMS. They're going to hold these claims until they can't anymore. So they issue those payments on time, which means 30 days.
Okay. Well, that's good to know. And Medicare Advantage isn't impacted. Is that
Yeah, no, that's totally separate thing. They've got their own system, their own pile of cash to disperse and all that. So this is just, when CMS pushes out these instructions to the MACs, the Medicare administrative contractors, this is all about fee for service.
Okay.
And really, they're holding these so they don't have to figure out what to do with telehealth claims if they get, retroactively authorized and that sort of thing.
All right, that makes sense. Good to know.
Yeah.
Appreciate that. I know the members will appreciate hearing that as well. And finally, team, and what are we hearing from AMGA members, and how did this get fixed?
It's bleak. I mean, talking to members, they are the level
Captain
of
Optimistic.
Yeah. The level of frustration, I think, is at a point that I haven't ever seen. Like, we've been through shutdowns before. We've been through COVID with these folks. We've been through some dark times and always come out on the other side. And I think, they know, intellectually, they know this too shall pass. And they understand the importance of being in the room and talking and engaging with members of Congress and all that. But I think the level of frustration with the process and how broken it is reaching a boiling point.
Okay. Anything more optimistic? Anywhere?
Well,
Anywhere?
on Daryl's point of, members feeling frustrated about the process, it can be easy to feel like there is no hope and no point. But that is not true at all. I would like to emphasize that. We still really, really, really need you to participate in our advocacy programs and to speak to your offices and representatives directly, because your voice is the most impactful.
All right.
I also like to point out that Daryl put the word opine, that we're supposed to opine on this.
Oh,
I
yeah.
just think
That's on the outline.
that's on the outline.
It's highlighted, by the way.
I did put your name first, though.
You did.
Yeah.
I appreciate that as always. Yeah.
But Daryl jumped in first. Did you notice that? Yeah.
We went off script.
Okay. So,
I don't have anything else to add other than I like the word opine.
I reckon we've opined.
It's a mic drop.
Okay.
Yeah.
All right. Great.
you.
So we'll end with Alicia and Lauren opining. All right. And I think that's it for the team. One final thing before we all end. November is National Hospice and Palliative Care Month, and we will have a podcast featuring Beth Averback from Health Partners in Minnesota, who will also be the chair of the AMGA board in January 1st. So an outstanding podcast, an outstanding physician, and look forward to hearing from her. And with that, I guess we will say thank you, AMGA, and all other listeners, and have a good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.